doing quality accreditation for hospitals from NABH to JCI. We have paramedical center also. We have established this paramedical center in Jajpur, Odisha. You all know that AIS provides certificate courses for healthcare professionals. And let me also make an announcement that we are going to launch many more programs within this year, as we have launched ICN 3.0 recently on January 2025. So stay tuned for more such updates with us. So now I would like to introduce our expert and facilitator for today's webinar. She is Miss Deepa Chugh, ma'am. And today's webinar is basically on nurse-led healthcare promotion programs in schools. So Ms. Deepa Chugh, ma'am, who is already an expert and facilitator, and she's a nursing director and professor, AVBRH, Datta Meghe Institute of Higher Education and Research, Wardha. And she has total 22 years of experience. Let me tell some more about her. And she has total 22 years of experience. She is also an NABH assessor. She had published various scientific papers in national and international journals, expert speaker at various forums, author for chapters in nursing books. So over to Miss Deepa Chugh, ma'am.
Thank you, Prachi ma'am.
Thank you so much.
You have humbled with the introduction. And it's been long for me now to be associated with Astron. And I really have high regards for this organization because, um, Astron thought about online qualifications, trainings, and everything far before COVID. So, it has been the brainchild, I think, that others, they started copying it. And now today it's a mode of uh, educating ourselves, training ourselves, and qualification also. So you are amongst the few in the country who thought before the damage could actually occur. So that's why, when everyone was struggling to come on the platform of online trainings, you were already on it. And there were no glitches in between, there were no gaps which Astrons had seen it. So that's the beauty of this organization, I would say. And because you have been the pioneer, you are excelling it day by day. And congratulations for adding up the courses, as well as your paramedical course, which you have launched in Odisha. May this organization have loads and loads of further success, and my privilege to be always associated with it. So
Thank you
let's,
so much, ma'am.
I can start it now?
Yes, ma'am.
Okay. The topic, when I was given this topic, before I could, I actually start it, I just want to tell to the people who are there that this is one area where I think very few of us have also thought about it. In fact, the nursing curriculum also does not have this element till date as a full-fledged platform, because there are the nursing curriculum is more targeted on scientific backgrounds and everything. No one has actually thought of school health to be as you know a stream, specific stream for the nurses. We have critical care, we have OT, we have rehabilitation, palliative care, pain management, diabetes, and I don't know what all things in the arena of nursing we are having. But school health is something which we have always kept aside, I think. And again, that it's a credit to Astron to have thought about it, because today's education, it's a mandate from the government of India to have a healthcare setup, a small healthcare setup in every school. And that's why it's a mandate to have nurses being working in the setup. Just let me share my slide. Just a moment. Just a moment. So, we will be talking today about nurse led health promotion programs in schools because it's been now many years that the government has made it mandatory. And now, even in the rural areas, nurses are posted in the school and they take due care. Let me tell you, presently, I am in a rural setup. I have been in Delhi, the capital of the country, and now in the rural setup of India. And believe me, it was wonderful to see that there are two nurses in the nearby school which we have, as well as we have almost six schools. One school is having two nurses because the footfall is high in that school, the admissions are high. The rest schools are having one nurse and a very good health, small like a small PHC. It's set up in the school, and the wonderful work which these nurses are doing without even having a background. So imagine if they get a good background and they understand what exactly their role is, how they can aid in preventing the illnesses, because prevention is always better than cure. Our country will have a healthier population. That's why we say that if you want health in the future, you have to empower your children. And they can be empowered by small efforts by the nurses. So let's just have a brief understanding what are we going to learn today and what would be outcomes of this session today. We will basically try and understand what would be the roles of the nurse, and we'll try and explore some health issues which the school children are facing in today's time. We'll learn certain strategies, how we can improve effective healthcare programs, health promotion programs in the school, and we'll highlight how these school health initiatives can bring a brighter future. When we talk about schools, it's not only the children which we are targeting on. We are also targeting on the teachers and the faculty who are working over there. Okay? So let's first understand what is the importance of this health program which is there, which we conduct in the schools, and what it is addressing. So first and foremost, when imagine even you and me, after we are born, the most contact period, the maximum amount of the contact period of our developing age, we are either at home or at school. So yes, our home values, our culture, our society plays a huge role. But more than anyone, it is a school which plays a major role in giving a foundation of our behavior, foundation of our personality, what I am today is quite a lot more by my teachers. Can I request the participants to mute? Even the health habits, because I remember the health habit of participants. Yeah. So, the habit of washing my hands, I would say I learned from my school because it was mandate that we are supposed to wash our hands before we eat. So our teacher used to take us towards the washing area, and we had a very big washing area, open washing area near to our playground. So we will go wash our hands. There were, I think, 10, 12, in line taps were there, and wash our hands, then come back, and then take our tiffins and then eat. And then again, she would stand and make us wash our hands, then go for play, and then come to the classroom. Right? So that inculcation of that small element has been in my life from that age of 4 5 years till today. So the schools are the ones which are building the foundation of healthy habits. And be it your teachers or a school health nurse, she can be the best aid to be the the torch bearer of health in the schools. Then comes is your early interventions during chronic conditions of some of the school children, because few children, they are having some genetic problems. They come up with infectious diseases, all land up into chronic diseases. So if they are having these challenges, they find it difficult to remain in the school, because the other children, they do not have understanding. Okay, so we as healthcare professionals can aid into that. Also, in today's time, that health prevention of health conditions and promotion of health is in the academic curriculum also. So recently when I was talking to one of our school health nurse, because our organization is also having their own school also, so we have two nurses who are deployed there from my department only. And I was just talking to them that what all you do. And they told us that every class is having 6 sessions per year to undergo with us basic preventive strategies, even dental hygiene to hand hygiene to keeping yourself clean, what to eat, what not to eat, what is obesity, what is malnutrition. So those simple topics, class wise, they are supposed to take 6 sessions per class. So they are now the part of academics. Now this is the initiation taken up by one organization. Like that there would be many organizations. So there's a huge scope for nurses to now be part of the school academics. Okay, in the rural area as well as the urban area, there are a lot of inequalities which are there. We are not having the facilities what I think I would be the best person to tell you. I've worked in Delhi for a long time, and recently, and now I'm in this place, this small part of our country, and I see the health services are very good even in this part. However, the diagnostics part of it, the super speciality which is there, is lacking. So we as nurses are able to bridge that small gap through technology. It's the nurses who are in the rural setups, furthermore interior of these places, they're able to connect to the tertiary care centers and bridge that gap which is there between the urban and the rural settings. This is just a nutshell that how important is the school health program. I am not very sure how many of you have heard about Anganwadi programs and all, because they are also very effective mechanism by the government to implement good health services and implementing preventive strategies in the beginning years of life, which is called as Anganwadi. They are like play schools in the rural setups. Okay. So let us now understand what all components are there in a school health program. School health program is not only targeting health education, that okay, you are supposed to teach the children what to do. You also have to be the torch bearer. You are now, what you do, children will see. What you do, the teachers would see. They look upon to you. Okay? So not only that health education, but also you have to be the member in physical education. Because if the children who are there in the school are not physically fit, then do whatever, even if you give the best of the health education, you will never be able to bring healthy society. You have to incorporate that physical strength building. And it is now very important because today's children, they lack physical activity. They are glued to their mobiles, they are glued to the technology, and slowly we are going away with the physical strength training, which during our childhood Our childhood, I remember majority of the time we used to be outside this house. We would be playing, uh, be it simple games to games like football and throw ball and all those things. But today's children, one, they do not have space. Second, they're not being guided well. They are glued with technology. So it's our responsibility to bring to the knowledge of the academicians also, because what I also see with my children, that the school is more emphasizing on the academics part of it. Very good, it is required. But along with that, physical education is important, and you can be the torchbearer for that. Health services in the form of home visits, or in the form of creating small OPDs, or creating camps for the school children to attend. These will bring better services which are reaching to the grassroots of our population. To nutritional services, and again I would take the example of uh, government of India, because the midday meal program which is there, it's an amazing program with a lot of funds being given by the government, and lot of our children have benefited from this. The amount of the number of malnutrition children which were there 10 years back, 15 years back, versus what we have now, has improved drastically because of these midday meal programs which the government of India has done it. Many of the NGOs have also come forward to join hands with the government and implement this in many of the schools, especially in the areas where the income of the population is very very low. So that's one component, one of the component of school health program. Counseling the children, talking to them. Today's time, many of you are from the cities. Both parents are working, they do not have time to talk to their children. You can formulate along with the teachers a session where let the child come and just talk to you. So not exactly counseling and all, but today's children want someone to be spoken to. And that's the main reason that they are all busy chatting, because they want to chat with someone. If they get that someone in you, I think we will solve that problem. School environment, if you see, um, you know, uh, I would say that the rural India schools are better in terms of cleanliness and the discipline which they maintain versus the urban areas, because the urban children are not taught the or not inculcating those values of doing it by themselves. I'm sure none of you would have done jharu of your school, but here, if you see in the rural areas, they create these programs. So I think now we have to bridge that gap. I happened to go 2 years back to Bhutan, and there were these small children, maybe age must be 6 8 years, and they all had some gunny bags in their hands, and they were picking something from the roadsides and putting it in those gunny bags, and there were like many children in that road. So I just think, what are they doing? What these children are doing? So we just stopped there and found out what is it. There was one adult also with them, one male adult, one female adult. So we just asked. They said we are from the school, and we have this drive every weekly drive we have from various classes, where we go even to the streets and take out all the garbage which is there in the streets. And all the streets were so clean, they make them do it. What in India we are failing to do is we are just preaching without even getting it done. So it's your role now that implement a strong health promotion program in the school, wherein the children are part of it, parents are part of it, community is part of it. Okay, so make the community involved in the health promotion program. So these are the basic components which is required for school health programs. Rest is all imagination, rest is all your creativity, how you can enlarge it also. Basically, the role of a school health nurse is to provide direct care to the students. Many children are having a lot of ailments. There are children who are into special schools. So you are there to help them out because with the health parameters of the children are there. We as Indians uh, should not be actually proud of that we are leading into diabetes, and juvenile diabetes is the highest in India. Very sad state of affair actually. I personally have seen children who come with those insulin patches. They carry tablets with them. The teachers are being informed. The school health nurse is being informed, and the nurse, the student goes to the nurse's OPD, and the nurse provides insulin at times because, see, everyone cannot afford these patches. They're expensive. So here also we have the school health nurse who gives these insulin shots to these children when they come. So you are the direct provider. If there is any accident, injury, you know what to do. So the first role comes of a nurse is to direct care to the students. You also are there for providing screening, and majority of our lifestyle illnesses can be screening, I would say, for the children, but also for the staff who are working over there, the teachers who are working, the non-teaching staff who are working over there. Even if you identify those and refer them to the right place, then you are improving the health of the society at large. Say if we are doing a screening program for oral hygiene of the children or the dental caries, and there are skin infections, allergies, these all screenings are very regularly done. And also, if you identify those, the treatment can be started early. And if treatment is starting early, the life is better. I mean, the quality of life is better for these children. So the second role is very important, that is the screening, and then you can think of referral to higher centers. You as a nurse are the torchbearer to promote health and provide through your health education. It can be spontaneous, it can be situational. Many a times we plan out one thing, but for that particular month, say this month, the weather is being changing here a lot. Daytime it is quite hot, but the early mornings and the late nights are quite cold. So there are a lot of these cough issues and bacterial infections going around, some viral infections going around. So you know that before Sankrant, all that starts. People over here, they talk like that. Before Sankranti, these would be there. And during the time of Lodi and Sankranti, when the fire would be enlightened, then all the illnesses which would be there would slow down. So actually, if you think about it, it's the same way, right? So you have to start your educating your children, the staff who are there, how to prevent them, because dust, pollens, weather changes, all these things can affect. So this is one small. This is situational. I mean, environmental. It could be anything beyond it. It could be disaster management. There are a lot of drills nowadays happening of disaster management. There are drills which even our hospital conducts good number of sessions for the schools on BLS, CPR. We take our dummies, we give them opportunity to do it, and even teach that if something happens at home, what are you going to do? Whom are you going to call? How to dial? Even small children, we teach that how you're supposed to dial the number and call, and what are you going to talk, what are you going to tell. Okay, So these are small health education which will build our nation. And you being there with them, with the children, you are the one who can be the leader of providing these services. And we look forward that few amongst you join these schools and bring in actual good changes for the future generation to come. You are the one who would be, your role would be more into promoting health, um, preventing health, and promoting health. Curative part is a little, at the background of a school health nurse. Our main target is prevention, promotion, and then for few children only curation. So basic things. If a wash basin is not working and there's a lot of water stagnated over there could be chances of mosquitoes. If there are not enough number of hand hygiene stations like the wash basin, or the cleaning of the tanks are not done properly, so safe drinking water is not there, you come into action, right? So this is how you can actually promote these basic health related environment for the schools to have a healthy place to live in. You also are, a part of the school where the policies and programs where they can create. You have to be an active member into it. You should be the leader towards it. Okay, because there is no doctor in any school, and even if the doctor is there, the doctor comes only for an hour or so. It is you who are there full time, and you need to take that up. Many people, I hear in many conferences, many experts, they speak. Nurses should be empowered. I, I, I don't know how to give empowerment to anyone. I don't know. We have to take our power. We have to take that power and become one empowered. Right? So once you start working, you have to take that initiation, that zeal, that fire which is there, that whichever place you are, you have to bring in the change. And if you are a school health nurse, you are at the best of the place, because this is the future of the country. You're bringing up the future tomorrow of our country. एंड आपके ऊपर बहुत भार है, आपके शोल्डर्स के ऊपर बहुत भार है, if you are working as a school health nurse, because it's not only the child which you are, catering to. You are catering to the family, you are catering to the healthcare institution, you are also catering to the community at large, and ultimately to the bigger goal, India. Just to brief all of you all know about this, few common issues which the children they face when they are
यार
in
ये आपका
school.
बैग स्टिफ हुआ है.
Malnutrition and anemia is seen rampantly. Now, let's compare that also urban and rural. When you see the urban children, don't think that they are not having malnutrition. I would say I was associated even in Delhi in few of the government schools wherein there was obesity because of obesity, because eating right, and in rural they are not eating what they're supposed to eat. Okay, so it's very common thing which is seen both places. Urban has their own different reasons, and rural has their own different reasons. Within 2 days, you will start seeing, if today the X is absent, tomorrow Y will be, after that someone else will be, viral fever. So the infection spreads because the population of a country is quite high, and in each classroom there are 40 students minimum, and they're not like sitting distant to each other, they are all close. They're children, they hug each other, they touch each other, they will be always with groups. They like that, social being. They are the epitome of social being. Huge number of students are being seen in today's time with substance abuse. And we might think that hardly some percentage. Gone are the days where we think that. Again, there is no bias. Be it a rural area or be it a Urban area, substance abuse is abundantly available. It's becoming open, it's becoming very easily available. And because of the peer pressure, these children, they get into it. So you need to identify actually what is the behavior change of a child. Are there some signs and symptoms where you can see that, okay, might be there's something wrong with this person and let me check in. So that was one thing which I should emphasize on: substance abuse. Be very, very careful and be very observant. Be even if you're not a school health nurse, even if you are just a member of this great country, the citizen of this country. It is our right, it is our responsibility to identify and safeguard our future generation. Obesity increasing day by day. Again, no bars, be it rural area, be it urban area. You get everything in today's time. You won't imagine. We even have avocados available here. I mean, seriously, uh, how come such a small place of the country? And why are we going with all these Western things? We also have Pringles and you name a brand, and we have it here. Eating anything and everything is available. Okay, Pizza Hut is there, Domino's is there, Cafe Coffee Day is there. Yeah, Starbucks has not reached. It would not reach also. But a part of that, anything and everything. You name good brands, you name anything junk, it's all available. So it's not that only cities are having it now. Even the rural area and the rural children demand for it. It's all because of technology, and everyone is aware about it, and the demands increases. Okay, so you have to need to understand that obesity, if it is increasing amongst children, and recently I was reading an article that 30% of our children, Indian children, are now obese, not overweight. Okay, obesity is different, and over being a little overweight is different. So we need to be very, very attentive, be it as parents or be it as this member of our society. Dental care is very common because even I tell you about my children, I have to go on asking them, ब्रश किया, ये किया, सोने से पहले किया, तुमने कब किया? I even go and check their brush whether it is wet or not. Okay, so because they're children, we can't expect them to behave the way which we have disciplined, kept us as a discipline. So we have to put in a little effort. But if it is there, then school, in every school we have those camps wherein dental hygiene is taken a very important role. Vision and hearing issues are increasing day by day. Accidents and injuries. अब बच्चे नहीं गिरेंगे और बच्चों को चोट नहीं लगेगी तो किसको लगने वाली है? तो ये तो होना ही है. But it should not be anything major. It should not be that it should not be because of mischief. Okay, uh, my son's classmate had a major injury. What these children, especially the boys, they are very notorious. What they were doing is the classroom door. One batch of the boys were trying to close the door. The other side of the boys were trying to open the door. So in that mishap, one child's two fingers, huh, the ring finger and the small finger, got in between the door, and it was smashed. It was crushed injury, and they had to amputate the fingers. They couldn't save it. This kind of injuries were happening, and the entire class or the entire school was in a big trouble because of this kind of accident happening. So this is live. I have seen it and felt so bad for that child that just because of small mischief, this major accident, and it has remained with him for lifelong now. So you have to be, as a school health nurse, it's important to teach the children how to prevent even accidents. Be careful. Mm, children have to be, they would be mischievous. Their nature is so, but it should not harm someone. So your role comes over there. But these are the common things which you will be facing. And if it is there, how are you going to treat it? Allergies and infections are very, very common. In the urban areas, it is more because of the pollution. In the rural areas, it is more because of the lot of pollens and the open areas are there. So, those dust which is there in rural areas also is a problem because of that allergies. Direct sunlight, again, there are photosensitive children. There are children who can get allergies because of pollens, because of food, anything, personal hygiene. Many children, and especially, I would say, the teenage children, as they grow, as they come to puberty, their body odor starts coming. So it is the school's responsibility to inform them that these are natural phenomena of human body. But being natural, in spite of that, we have to take care of our body odor, hygiene. If the child is told that, because of puberty, hormonal changes, this, that, you might have to take bath twice or start using mild, deodorants or something which very young children know, but child sensitive products are available in today's time. They are very, very mild, and their pH levels are the normal human body pH. So those are very safe to be used after the dermatologist recommendations. So you have to teach them uh, private area cleanliness, you can say perennial hygiene, their body hygiene, hair, because many of them, they want to use products, gels in their hair. Recently again, I was reading articles where they said that children, especially the girls between the age of 8 to 14, have also started using heavy cosmetics. I mean, heavy cosmetics. The word used was heavy cosmetics. 8-year-old child using cosmetics. Where are we landing into? So it's our duty to, actually stop these things. To put the school in a small nutshell, what all things, if you start working in the school, what are the few highlighting areas where you have to put your emphasis into? The first and foremost is nutrition. Make sure that children are getting good food, nutritive food, be it they bringing it from home, or be it being prepared in the school. If it is being prepared in the school, then it is more of your responsibility to make sure that the food which is being provided by the school is healthier version, not junk food. Health education, as I told you, this girl, when I met her, she was telling me that I take 6 sessions per class on various topics. And also from the hospital, we send additional team for CPR, for oral hygiene checkups, for skin allergies and all those things. So there also we inculcate those values to our children, that health education, you go on hitting in their brain, and eventually they start doing it. We also, recently did a drive for school children, wherein because it's a rural area, a lot of the children where they are staying, their open drainage system is there. So how to clean those drainage system, how that water should not be stagnated, and if there is stagnated water, where they should report and all those things. So there's those basic things depending upon which area you are living in. Say if you're talking about bigger cities, then things will be different. You'll have to also teach them maybe good touch and bad touch and all those kind of things also. Those are also small basic health education. Physical education, I've spoken that physical activity is mandated. हम बोलते तो रहते हैं, हम कितना कर रहे हैं पहले हम भी देख लेंगे. So first, inculcate life. The more you know the value of the, you will be the brand. Staff welfare. I was telling you, school health is not only for the children, the staff who are working. They imagine I have two children, and at times I get so bucked up with them. I really hats off to the teachers who are taking care of 40, 50 children at one given time. You would just be going crazy, you know.
पेशेंट का आज
So, staff wellness is also very, very important, and you should emphasize on their health checkups, stress management, physical activity for them. Try and inculcate the values to the family also, and for that, in between, you should call the parents and let the parents be party to the health education sessions and the health drives which you are keeping for the children as well as for the family. Create a clean environment. If nothing, at least clean environment. Teach them that importance of cleanliness. And for that, you again have to be the torch bearer. आपको वो जिम्मेदारी उठानी ही पड़ेगी. हर चीज आपको गलत लगनी चाहिए तब जाके चीजें होती है. Otherwise, it would just go. If you are walking and if you see a garbage kept over there, पेपर पड़ा हुआ है, कुछ प्लास्टिक बैग है, you need to pick it up, put it in the dustbin. They will learn, the children will learn. And staff, as be it the teachers, be it the school health nurse, we should practice than preaching. Counseling and support, again, as per the government guidelines, it is now becoming mandatory that you have to have a school counselor. Every school has their own counselor. But if any school which is, small schools in the remote areas, we might not get counselors. So the school health nurse works as a counselor also. Various health services, you can tie up with various hospitals where the healthcare team can come and take care of your children, have screening programs for them. So all those health services can be performed by the school health nurse. Now, if you see the bottom of this diagram, it's all about the background of the school. That means before the child can come to the school, this child is also having, influence by the family, the culture, education, the community where this child belongs to, what kind of predominant, business is available in that area. Business does not mean the working class, we are removing it, but what kind of, the work culture is there, public services, what kind of public services are available, area where the child is there, and how much media exposure this child is having. So all this will aid if you are, conducting a health education program, say on substance abuse. You should know better than the children, because children, they know it far better than you in today's time because of the social media. Okay, so you should know the level where the children would be knowing. So all these things are very important. Which background of children you are going to deal with. If they are from very influential families, your performance have to be different. Versus if you are in the rural area, it will be very different. Okay, so it will all depend upon the bottom. If you see the diagram, it depends upon all these factors. How the school health program will be different. If you are doing it for a very influential school, absolutely different program. You're doing it for Anganwadi, it will be very different program, right? So it will be all depending upon the background of the school. Very, very important aspect. I think this, if you even learn this today, I think we will achieve. Health can be achieved if the children are mentally stable. Lot of the illnesses what we are seeing in children today are because of mental health issues. There was this survey which was done in the year 2022, which said that most frequently cited reason for anxiety was studies 50, by 50%, followed by exam and results by 31%. पढ़ाई का प्रेशर इतना ज्यादा है कि 50% स्ट्रेस एक बच्चे को पढ़ाई के कारण है. एग्जाम का रिजल्ट्स क्या आएंगे. The competition is so much, the population of a country is so much, it's never ending that the competition is going to go down. It is increasing. The benchmark of competition is increasing. And we as parents, we as society, we as the community are pressurizing our children. Okay. So this is the level where our children are stressed out. 29% of the responses reported lagging behind in students in studies due to lack of concentration. This social media, this mobile, TV, so much of distractions in today's time, concentration levels have reduced down. 30% of students agreed to doing well in studies for social values and approval seeking. That means they want to just keep their society happy. 36% of our children are actually being burdened by their parents that do this course, become an engineer, become a pilot, become a scientist, become a nurse. So, what kind of generation are we creating? So, because of these pressures, 33% responded agreed that they tried to please friends most of the time. Peer pressure. Even if I don't want to do it, my child doesn't want to do it, he or she would be forced to do it, okay, because of the peer pressure. And at that age, if today someone tries to influence me, I would never be influenced because of my age, maturity level, right? But at that age, that immaturity level which is there amongst the teenagers, amongst the children who are school age children, we can't compare it. We can't judge them on that. Okay. 45% of the children they feel lethargic, their energies are low. Within 2 to 3 times in a week, they find themselves low. Why? Because physical activity is not there. They're not engaging. The social activity is not there. They just come from the school, come home where there is no one. They sit, put on the TV, eat something, sleep over. By the time they get, they have time, or even many of them, they don't even sleep. They have now time to go to their tuition classes, to extracurricular classes, to music, to sports, to this, to that, to that. Where is that me time? Where is that loneliness gone? In our childhood, we were just doing nothing, but we were happy. We were happy generation. So we need to not pressurize our children. म्यूजिक भी करना है, डांस भी करना है, तुमको स्पोर्ट्स में भी रहने का है, उनको थोड़ा छोड़ देना है. आई थिंक दैट लोनलीनेस इज वेरी इंपॉर्टेंट फॉर आवर चिल्ड्रन. Just few things. What all things? The same thing. The environment, the academic pressure, family pressures, the digital media which is there, the economics of our society, the childhood trauma some children they go through. These are the various factors, and many times it is also genetic that the children of today are getting stressed out. They are having mental health issues. And let's target that at full swing. Otherwise, we will have a generation, we'll have a full generation who will not be mentally stable. And a society where the mental stability is not there, that society is dangerous. I use the word dangerous because it is actually, you are sitting on a volcano if you don't start acting now. Basic things to remember if you want to address mental health in school. The 5 T's. Talk. Talk to people. They will come out. You do not require counseling lessons to learn how to do counseling. You just need to sit and talk to children, to the staff. स्टाफ भी आजकल बिजी है बिकॉज लिमिटेड इसमें उनको एकेडमिक्स भी करना है, उनको अपने मोबाइल भी चेक करना है, उनको कॉपीज भी चेक करनी है, उनको एग्जाम भी लेना है. वी नीड टू ब्रेक दैट स्टीरियोटाइप. I am forced to tell you this because again I'm comparing my life what was in Delhi versus what now. I see people over here very chilled out many a times, especially after their dinner. They do a very early dinner. So by 7:30, 8, I see people nicely sitting outside their corridors, or many of them, they have nice jhulas outside the house. The swing is there. So the family members are sitting and just relaxing. They're not doing anything. They're just not doing anything. They're not watching TV, they're not doing anything. Just just doing nothing. The art of doing nothing. And that's actually important because at that time you're connecting to your family. It's important to learn. We in the urban places have forgotten doing that. Let's talk. Training not only to you as healthcare professionals, also to the teachers. Incorporating mental health into teaching. Your teachers are the best people who can implement that. I do understand, all of us, when we get stressed up, we get angry, we may tell something, and children, the way they take it, they are not the ones. हमें तो मार भी पड़ी हुई है स्कूल में, हमने कोई bother ही नहीं किया. But today's children, you can't do that. They're very sensitive generation, right? So you have to inculcate those values to your teachers also. Certain tools to enhance the mental health, like relaxation techniques, mindfulness, taking them for art projects, creating that environment of taking out whatever is in their mind, and also make sure that you are keeping your teachers happy. A happy teacher will create a population which is there is happy, and we that's why need to target on that. The same thing what the 5T says, this is the implementation chart. How would you get it implemented? You can get it implemented by inculcating those what we have spoken about in the curriculum itself. Well, it's very sad that we cannot bring in so much in one curriculum because children have history, math, English, Hindi, vernacular, one language would be there. Then they have science, they have so many other subjects, music, computer science. What all things poor children they're going to learn? But a small thing, maybe in a chapter of science, maybe in a chapter of civics, we can inculcate these topics of be it mental health or be it physical health, because they are not separate, they are together. Okay, involve the parents. Involvement of the parents is mandate. Be it any place you're working, they need to take the charge of their children. It is a very very tough responsibility, and they have taken that, so they will have to perform it. Make sure your teachers are stress free, they are happy, and that environment, not only you can do it, your school management also has to be part of it. So you have to create that support system from the management side, and also create some community engagement activities. There's a teachers group where a lot of activities like yoga, they go for picnics, they have a club, they have a small association of teachers. So like that wise you can create something for the nurses also, something like that, so that we have to socialize. A human being is a social animal, and we need to come together to be happy. Okay, so this is small about your mental health. Then comes very important aspect, the challenges. Not everything what I spoke is able to be implemented, come out of your mind. Even 25% gets implemented, our country will be a different place to live in. But we'll have to go on giving, try and try till you succeed. So there'll be a lot of challenges. Few to mention are the lack of resources. We are a developing country. We do not have abundance that we can just use the infrastructure. We have the best of this, best of that. No, we are having very low budget. Our infrastructures are actually poor. And, at times I see even schools, they have such tattered kind of the playground. The children are not having proper shoes. How would they have physical activity? They're not being guarded well. They're not having good toilets to use. So these are few things. I know it's a challenge to get that thing done from the management of the school or even from the government, but we'll have to go on giving the try. If we go on saying that, what can I do? Then no one will be able to do it. High workload. Teachers today are being given huge targets. Gone are the days where teachers used to only work for 6 hours. They work 6 hours in the school, and beyond that, they work at home also. So this huge pressure, be it the nurses, be it the engineers, be it the teachers, everyone is having. We are all sitting on a pressure cooker. Kab seeti baj jayegi. So with that workload also, still we have to take out time. That's how time management works. Then limited support from the parents and administrators. I've already spoken about the administrators. They would never agree, but you have to make them agree. You have to put forward the benefits and what they can prevent. And maybe after asking for this much, you may get this much. Then also you are successful. Bringing the parents to the school is a task. Let me tell you that. And I, being a parent, I'm telling you, we make sure, me and my husband, we make sure only one of us go to the school. Whenever there is a parent teacher meet, or whenever, even the annual day. If this year I have gone, the next year he would go. Like that, because we both are working, right? But we are working for whom? So you have to involve. If not both, at least one. Make sure that they come, be party to it. Make them also aware. Till the time they don't change their attitude, children would never be able to. So you need to work not only with the child but with the entire family. Time constraints are big because every school is working for 6.5 hours only, not beyond that. And in that, there is lot to do. There is school vacations, then there are a lot of chuttis, there are examinations, this, that. In spite of that, one of the biggest challenge with today we are facing in India is the stigma of mental. So many children who want to actually come, but they can't because their fear will put a pressure. They will start teasing them. So you as a school health nurse have to combat that, approach them. You have to go. गया वो जमाना जब प्यासा कुएं के पास में जाता था. अब जमाना ये है कि कुआं उठ के प्यासे के पास में जाना, right? So you have to go, you have to approach and make sure that your generation and my generation does not has created my children kind of age people that they are lethargic, they don't want to work, they are kind of people whose different slang, their language we don't understand, their wavelength is different than ours. Yes, it is there, but we need to increase our wavelength as per them, and they would not be able to bring it down. They are the generation which is, they are very thoughtful. They think a lot. They don't want to work hard like us. At least my generation. आपके इसमें भी बहुत सारे youngsters बैठे हुए होंगे. Nothing against you are smart generation, right? But our gaps should not affect the community, should not affect India at large. Okay, so we'll try to improve ourselves. You also bring down yourself a little, and we will make a better India, healthier India, I would say. How are you going to combat these challenges? Are one is single be party to the school programs also. Stand for the rights of the children, stand for the health of the children. If parents are not taking care, you will have to bring in to the of the school administrator also. If you feel that this particular child is deteriorating mentally or physically, it's your responsibility to advocate about that child. Okay? You can't just say that I have written a letter to the parent and my job is done. You have to be the advocate for that child. Make simple programs where you're not spending in much time. Could be just a small quiz, could be small game, could be anything, could be an art session wherein they are able to bring out themselves, they are able to tell you what challenges they are facing. Because they don't know, as children, they don't know how to express it. Every generation is different, every child is different, right? Conduct as many as possible training sessions. We say we go on telling ना इतना पढ़ाया इनको इतना पढ़ाया फिर भी इनके दिमाग में कुछ जाता नहीं है. You know what is the outcome of training? If you give 100%, you get returns of only 1%. That's where the outcome of training is. Such low outcome. But we are working for that 1%. You know? So let's target that. आज 1% है, कल 5 होगा, उसके बाद बढ़ेगा. Let's hope for the best. As I told you, community partnership, get maximum number of people. You know, keep our time we used to keep some school fete, aju baju wale log, parents, our friends, our family friends, they all used to come to the school. आजकल वो सब नहीं दिखने को मिलता है. So I think we have to bring those old traditions also and bring technology also. So old and the new both should come together and start working. Then only we can build a healthier society. So this was just in brief what a school health program looks like, or what as a school health nurse I should be doing it, because children are important to our nation. They make the next generation. They are our tomorrow. And let us all join hands together and make every school, every child, the beacon of health and wellness. Then only we can become we are the diamond. We are reaching, just about to reach the capital for hypertension. Maximum numbers of antihypertensive drugs are being sold in India. So we are going to become this. We are the third colors. Diseases are maximum in our country. You and me are the torchbearer, and we have to start from this generation, this bacha generation, that they will be your guiding light. And tomorrow we can bring a healthy India and a developed India. If all of us join together, then only it will be possible. That's from my end. I'll be very happy if you come up with suggestions. Also, come up with your ideas. How can we improve this school health program? And if you have any doubts, would also be appreciated. Anyone? Is there anything?
Students, if you have any questions, you can please ask ma'am.
Chat box में भी लिखेंगे तो भी चलेगा. Chat box में stop writing thank you and good evenings, because that's not what we are expecting. We're expecting healthy discussions. We're expecting you to think beyond what our generation thought about it.
Hello, ma'am. May I?
Yes, ma'am.
Hello.
Yes, ma'am.
जी मैम, we can hear you. आप please पूछिए, आप question करना है.
Thank you,
Please.
ma'am, for this wonderful session. I am Dr. Sandhya Singh from Patna, Bihar. I am working as a principal in a school of nursing.
Great, ma'am. Thank you for joining in.
Thank you, ma'am. Ma'am, one thing I want to clear. जैसे कि स्कूल हेल्थ प्रोग्राम है, तो वो प्रोग्राम तो अभी भी मीन्स है एनएम से मीन्स करिकुलम में, बट इतना डिटेल्स में नहीं है. तो ओनली हम डिटेल्स में नहीं है. जैसे हम लोग स्टूडेंट्स की पोस्टिंग भी करते हैं, और हम लोग भी जब पढ़ते थे स्कूल्स में, या मतलब तो हम लोग भी जाते थे, मीन्स 1-2 एक्टिविटीज
बस वो जाते हैं,
इतना डिटेल्स
2 घंटे के लिए विजिट करके हम वापस आ जाते हैं, है ना?
यस राइट मैम, सही होता है. बट जैसा कि आपने बताया,
नीचे नहीं जा रहे हैं. आज हमें प्रिवेंटिव स्ट्रेटजीज पे ज्यादा ध्यान देना है, और क्यूरेटिव पे उतना एम्फोसिस तो है ही. हमारे पास में बहुत सारे हॉस्पिटल्स हैं, So there is a set
Huh?
of people who are taking care of curative. Now we want a good bulk of people to start taking care of the preventive aspect of our country.
Mm. Ma'am, that nowadays, in earlier days also, in Navodaya school, there is a provision for school health nurse. But in all government school institution, there are not means a provision for posting a school health nurse.
Madam, धीरे धीरे आ रहा है. I'm telling you, I'm also now in a place which is a small place.
Okay.
I would say this is tier 3. हाँ, उसमें भी आप हर स्कूल में है. मेरे आसपास में 6 स्कूल्स हैं. 6 के 6 स्कूल्स में नर्स है उधर.
Okay, okay, okay. But
So धीरे
luckily,
धीरे country is changing. Not that it is not. It is changing, and they are paying quite decent, equivalent to what a nurse is getting in the hospital. Because these nurses, they belong to our hospital only. You know what they have done? They have done a tie-up with our hospital that we provide one nurse to these schools, and one school has asked for 2, and they have a MOU with the system is coming up. When it has already reached the tier 3, you even Delhi had all schools were having school health nurse.
school health nurse.
Yes, Delhi had school health nurse.
Okay.
Yeah, not all government schools, but all the private schools were having it.
Okay. Thank you so much.
There's one who has written, ma'am, how to involve child who are always hyperactive. They are hyperactive because we are not utilizing their energy. Child has to be hyperactive. A dumb kind of a child has mental problem. The child is normal if the child is hyperactive. So first change your perspective that hyperactive child is not a problem. Hyperactive is something. Be happy that the child is active and utilize their energy in the right direction. हम उनको टाइम ही नहीं दे रहे हैं और हम चाह रहे हैं कि वो अपनी एक्टिविटी कम कर दे. ऐसा नहीं होता है. वी हैव टू गिव इन टाइम, एंड टाइम सिर्फ पेरेंट्स ने नहीं देना है, ये पूरे परिवार की जिम्मेदारी रहती है. आई ब्यूटिफुली आई सी इट इन दिस प्लेस. एवरी चाइल्ड is being taken care by grandparents, by their neighbors, by their parents. Majority of the time, parents don't even know where is the child going. कभी कोई घुमा रहा है, कभी कोई घुमा रहा है. Well, that's can't be done in urban areas. It can't be. But the nuclear families are having genuine problems because of that. So we need to work on that aspect also. That's a different part of it. But engage the child into various activities. तो वो child एक productive child बनेगा. Don't call the child hyperactive.
Any
Anything?
more?
No?
Please? Anybody?
No, I think it's, yeah.
All right. So, thank you so much, Deepa ma'am. A very good evening to everybody, and thank you so much. It's always an honor to have you with us, and we're so grateful to have you as our academic expert associated with Astron. And we always feel that, whenever it's your webinar, we all just stick on to the laptops and the desktops and we just keep listening to you because there is something or the other which we as individuals get to learn. And thank you so much for it. And we are really grateful that, webinar and, you come up with something new, something very innovative and which is actually the need of the hour. So thank you.
All my
Thanks
pleasure.
a lot.
Thank you.
Once again.
Thank you all the people who have joined in, and 40 of you all in the cold weather joining in. It's shows that today's generation wants to do something.
Absolutely, ma'am. Absolutely. Thank you so much. And a big thanks to our team of counselors who worked so hard for this webinar. Thank you so much. And we will be, as Charul told in the beginning, that we are coming up with new programs, new courses, and our vision is in 2025 to give new areas and new arenas towards nursing profession and also towards the healthcare professionals. So, as being led by Dr. Niru and Dr. Yashpal Bhatia, we are just following, their instructions and their guidance, with which we are able to fetch new courses and a new vision. And ma'am, very soon we are also coming up with something which is very different, that is virtual reality programs for our nurses.
Oh, wow.
So it's also something very new, which probably with God's grace within this 2025 we will be launching.
Great, and good luck for that.
Thank you.
And you have visionaries with you. Both sir and ma'am have been, their vision I really appreciate, and I'm so glad always, and thankful also that I got associated, and I'm part of Astro.
Thank you so much.
I always feel it like a family somehow. I don't know why. Though we are distant to each other geographically, but
Yes.
there's a connect. So good wishes to Astron,
Thank you.
and भगवान करे आप तरक्की करते रहें और
Thank you.
विजनरीज आपके साथ में हैं तो वो होगा ही. Good luck to all of you.
Thank you so much, ma'am. Thank you so much.
Thank you.
And yeah, and for the month of February, we are coming up with a very hot. Actually, this was supposed to come in the month of January. It's about cervical cancer. We are organizing a webinar for that, for awareness and how the nurses play an important role, this for cervical cancer patients. So,
Lovely.
as women, I think it's very important for us to understand that, what are the symptoms, when we should actually, we don't actually understand the symptoms, but yes, we do have to get ourselves checked. And for the first time, my counselors are very excited for this webinar, because they are like, ma'am, we ourselves, can we attend it? Because we also want to know as women that, what are the precautions and what are the things we should keep in mind. So yes, that's something
Great
new which is
job,
coming up next.
and good luck.
Thank you so much, ma'am. Thank you
Thank you so much,
Thank
all of you. Thank you.
Thank
I
you.
take your leave. Thank you.
Thank you so much, everybody. Thank you, and looking forward for everybody to contact us soon to know more about the cervical cancer webinar, which is being held on the 22nd of February. Thank you, and we've also put in the number in the chat box, so anybody who's interested can just log into that number and message us for more details. Thank you so much. Have a very nice weekend, everybody.